Good afternoon, everyone. My name is Kalela Perot, and I will be your moderator this afternoon. Joining us today, we have Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia, and Dr. Andrew Lynk, Chief and Chair of Pediatrics at the IWK Health Centre. So we're going to start with a few remarks from Dr. Strang as well as Dr. Lynk, and then we will move to the room for questions and then to the phone. And on the phone, those of you who have identified yourself as having questions will call for a question to follow up, and then we'll come back to the room. All right, Dr. Strang, if you'd like to get started.
Thanks, Kalela. Good afternoon, everybody. Nice to see everybody again. I hope you're all up to date with your COVID and flu vaccines. So today, myself and my colleague, Dr. Lynk, are joining you to provide an update on respiratory illness in the province. I believe that it's important to let Nova Scotians know about our current situation and what we all need to focus on to keep each other safe. Right now, we're seeing a number of different respiratory viruses circulating in our community. As in the rest of Canada, our COVID activity is actually quite low and continues to decline, and there are high levels of immunity against COVID. We are, however, seeing the beginning of influenza season, with much of it in children, and it is about 6 to 8 weeks earlier than usual. And we also have a lot of respiratory syncytial virus, or RSV, and again, that's mostly impacting young children. Every year we see RSV and influenza circulating, but this year the disease activity is high, and as I said, has started earlier. We need to be prepared that this may continue for the next 2 to 3 months, although we can take some hope from the fact that while Australia had an early influenza season, it was not prolonged or more severe than usual. And the highest rates that were seen in Australia were in children and adolescents. So what can we do to protect ourselves, each other, and our strained healthcare system? We need to re-engage with the multi-layered approach that we have successfully used during the COVID-19 pandemic. First, get vaccinated against those viruses that we have vaccines for. Be up to date with your COVID vaccines. Get your annual influenza vaccine. This is most important for the very young and the very old and those with significant chronic health conditions. But these people need the rest of us to also be vaccinated to give them maximum protection. Getting vaccinated is a choice for protecting your community. Number 2, if you are sick with cold or flu symptoms, stay home if at all possible. Even if your symptoms are mild, like a scratchy throat or slightly runny nose. It's important that you stay home whenever possible. And I cannot stress this strongly enough. It's the people who are ill, who are infectious and able to spread the virus to others. I recognize that this can be challenging for many if they or their children are sick, but please make staying home if sick a priority. And I'm asking others, such as employers, to support this as much as possible. For instance, with opportunities for virtual work, paid sick or family illness leave, and other considerations. And also, I need to ask employers, please stop asking people for sick notes. This is an unnecessary pressure on the healthcare system. And to everybody, if you have even mild cold or flu symptoms, avoid discretionary, and by discretionary I mean those things that you have a choice about, the family gathering that you don't have to go to. Avoid these discretionary social and other activities. And please do not visit people such as an elderly parent or relative or a new baby if you have even the mildest cold or flu-like symptoms. And that leads me to the third point. Public health in Nova Scotia continues to encourage people to wear masks in crowded indoor spaces, and we all need to respect people who choose to wear a mask. But I would like to focus and ask Nova Scotians to focus on where masking is most important and where it will make the most difference. If you are sick with a cold or flu-like symptoms, even if very mild, and cannot stay home for whatever reason, you need to wear a mask. As I said, even if you have very mild symptoms, but do not feel unwell, so you have just a slightly scratchy throat or a bit of a runny nose, or maybe you have been sick and you're recovering and feeling better, please, and even if you're out and about, you need to wear a mask. And if you have any such symptoms, including mild ones, you should not be in close contact with people at the highest risk of severe illness. And that's the very young, the very old, those who have significantly or substantive chronic health conditions. And as I said, if you're recovering from a cold or flu-like illness and are starting to be out and about again, wear a mask for a few days. It's in these situations where if you cannot be home, where wearing a mask is going to make the most difference, because these are the times when you have the likelihood of being infectious to others. So I'm asking Nova Scotians to pay attention and to wear your masks in this focused, targeted way. By all means, wear masks in other crowded situations, but this is where it's most important for everybody. Stay home if you can. If you can't and have to be out, wear a mask. The fourth point is be thoughtful and careful of your social activities, especially as we enter the holiday season. And if you will be in close contact with people who are at higher risk that I've just outlined, also this is where you need to wear a mask. Frequent hand washing, sanitizing, watching where you place your hands when out in public and avoid touching your face with unwashed hands, as well as practicing cough etiquette. Cough in the trough, sneeze in the sleeve. Those are also important to minimize the spread of viruses. By all of us following these various protective measures, we can have a significant impact on the spread of respiratory viruses in our homes and communities. We can protect ourselves and our healthcare system and those who continue to work tirelessly in it for our safety. I know you will ask about mask mandates, so let me answer that right now. Mask mandates were used at a specific time during the pandemic when there were high levels of circulating virus and a population which was very susceptible to disease. That is no longer the case. We have high COVID-19 vaccine coverage in Nova Scotia, and many people may also have had natural infection. For mask mandates to be effective, there needs to be widespread public buy-in, and we no longer have that in Nova Scotia and across Canada. And also, mask mandates can only apply in public places. And what public health is seeing now is that much of the transmission of respiratory viruses is happening in settings where mask mandates would not apply anyway, like a private gathering in a home. My medical officer of health team, who are the ones involved on the front line reviewing all the case follow-up with COVID and seeing the patterns of transmission, continue to emphasize this point to me. And I've discussed masking mandates with this team, and we were in strong agreement that at this time, masking mandates would not be necessary or effective. However, we will continue to monitor our situation and would certainly change our position if we felt it was necessary. Instead of focusing just on masks and mask mandates, I'm asking all Nova Scotians to care for one another as we have done before and to use all of the protective measures just outlined. And when it comes to masking, focus most where masking will make the biggest difference. I'll turn it over now to Dr. Lynk to provide any comments.
Okay. Thank you, Dr. Strang, and good afternoon, everybody. I'll make a couple points, background points, then a couple recommendations as well. So last night I met with provincial and IWK pediatric colleagues, and we had a good talk about the current situation and our concerns in the coming weeks. And we all agreed across the province, from Yarmouth to Sydney and at the IWK, acute care services for children are stretched. And we also have staffing challenges as well as the high numbers that are coming to see us right now. These are at historic levels that I've never seen before in my career here since 1990 as a young pediatrician. Normally a very busy 24-hour shift at the IWK emergency department would be 120, 140 kids. That would be very, very busy. We're consistently hitting between 150 and 180, even up to 200. And it's a big challenge. Parents are having to wait hours and hours and hours and hours unless your child is extremely sick. And that causes frustration and moral distress for everybody involved. And based on what's happening right now in Ontario and Quebec, in the children's hospitals there they've got the full force of influenza on them. We're just starting to see that in the last week or so here. So it's going to get worse before it gets better. That's what our concern is. We are working very hard at the IWK and across the province to come up with surge plans in terms of staffing and space. But again, there's only so many pediatric nurses to go around. And that's going to become an issue for us that we're concerned about. COVID is still with us. I think 1 in 40 Nova Scotians are actively infected right now. And that also puts pressures on the regional emergency departments, which kids in Yarmouth, Truro, or Kentville have to go to as well. So that's still with us. We're not over that part. And the data isn't perfect in terms of tracking how many people get their flu shots like we had with the COVID shots. But at least at pharmacies, I think Dr. Strang and I were talking, it's probably less than 10% of the under 5s have had flu shots to date. And that's a concern, and probably fewer than that have had their COVID shots as well. So what we're trying to come up with is ways to flatten this big wave that's coming at us and slow it down a bit. We know we're not going to get rid of all of influenza and RSV and COVID. We have to live with those things. But it's this big wave that's going to cause or potentially cause harm and damage to the system, to the healthcare workers, and most importantly, to the patients that we serve. And I know Nova Scotians are smart, and they're caring, and they're community-minded, and they want to do the right thing. And we have world-class healthcare workers in Nova Scotia. No question. I worked all over Canada, the UK. We have some of the best and the brightest right here in the province. But we can't do this by ourselves right now. We can't deliver world-class care by ourselves. We need everybody in Nova Scotia to pitch in right now. And so what does that mean? And I'm just going to reiterate a few things that Dr. Strang has said. It means everybody, especially kids under 5, older folks, people with underlying conditions, but everybody to help prevent the spread of influenza and COVID. Get your vaccinations, folks. Get your vaccinations, for goodness sakes, and get your kids under 5 vaccinated. Anywhere from 6 months up, they can get either the COVID or the influenza vaccines, but get them vaccinated. Don't wait, because if you want to go to an emergency department with your sick 2-year-old, the high fever and throwing up, and wait for hours and hours and be sitting amongst everybody else, it's not a good situation. I just walked through our intensive care unit at the IWK today, and there's little babies and even 4-year-olds in with RSV who are in the intensive care unit. We have other kids in with flu now in the intensive care unit. We can prevent some of this. Not all of it, but we can prevent some of this. So get vaccinated. And as Dr. Strang said, if you're sick, go home and don't socialize if you can. If you have to go out, wear your mask. If you have to go to the grocery store and you have the sniffles and you have no other ways to do things. And for heaven's sakes, for parents, if you've got babies or infants or toddlers and you don't have to take them to the snotty-nosed cousin's house to play or visit, then don't do it. Please, just don't do it right now. Don't take the chance. And if you're going to visit homes where there's babies and small kids and you've got the sniffles or colds, don't do it right now. It's going to get worse, guys, so don't do that. And the other common sense things about carrying some alcohol gel in your pocket or in your car and washing your hands when you've been out in public and wearing your mask when you're in crowded places, and especially if you've got the sniffles, stay home. But we'll get through this, but we can't do it by ourselves, people at home. So let's all pitch in together. We really need everybody's help over the next 4 to 8 weeks. The other thing I'd just point out is Christmas is coming. And your healthcare workers would like a little time off Christmas and not have to get called in on Christmas Eve or Christmas Day because people are sick or the emergency rooms are overflowing and we need extra help. So let's do it for the healthcare workers and for your families and for your neighbors. Thank you.
Okay, great, thanks. We'll move to the room for questions.
Dr. Strang, do you have advice for Nova Scotians age 65 and older in terms of if the regular flu vaccine that's freely available is a better choice compared to the higher dose option?
So there's some evidence that the higher dose flu vaccine is somewhat more effective, but we do know that that there's good match this year between what's in the regular standard dose vaccine and the circulating strain, and the standard dose still gives very good protection.
Dr. Strang, your comments about a mandate notwithstanding, given what we're hearing from Dr. Lynk about the situation for young kids right now, can you talk a little bit about why the consideration is not being given to at least requiring masks to be used in the school system?
So if the kids who are by and large showing up, and what's driving pressure in our from our pediatric and emergency departments and hospitalizations, they're mostly preschool age kids. The ones who are most risk of severe disease from RSV and influenza are not school age kids. Yeah, there's a you could argue that that the older kids then transmit in school and take it home, but again, I come to the point that what we're seeing, and this is COVID, but I think it plays out in what social behaviors when we're following up COVID cases, where we're seeing most of the transmission with respiratory viruses is not in a place where a mask mandate would apply. We can't have a mask mandate that says you have to wear masks in your home. You have to wear a mask when families get together. That's why I think rather than talking about mandates, as I said, is a distraction. I'm appealing to Nova Scotians is to understand where masking will have the most difference. And those are those times that I've outlined when you can't stay home, when you have to be out and about, or if you have just very mild symptoms on either side of a beginning or at the end of a respiratory illness. So regardless of where you're at, whether a mandate would apply or not, those are the times where we need people to mask, because those are the times where people are most likely to be infectious, and a mask will help. A mask mandate, what you're doing is saying to most people who are, like me today, asymptomatic, feeling completely well, there's a very low chance that I'm infectious with a respiratory virus right now. So requiring me and most Nova Scotians to wear a mask every time we go into a public place, while we don't discourage it, to require it, there's not the level of evidence that we actually need to have that strong of an intervention. And one of the firm principles in public health is that you use the strength of measure that's required. And my colleague, Bonnie Hendry, I listened to her this morning, her comments yesterday in British Columbia, that a masking mandate is far too heavy-handed of a tool to be using right now. And I completely agree with her. What we need to do is engage Nova Scotians. This is what we're doing today to understand, and it's not just masks either, that multi-layered approach, using a mask where most appropriate and where most necessary. If we all did all those things we just talked about, that's what we need people to do, and that's what's going to make the difference in protecting each other and limiting the impact on our healthcare system.
And Dr. Lynk, I just wonder, you spoke a bit about how Ontario is ahead of us in terms of influenza activity right now, but you've also talked about how already things are sort of touch and go as it stands at the IWK. So how much leeway is there at that hospital right now before you're going to have to start making sort of drastic changes to accommodate the volume you're seeing, and what kind of changes are being contemplated?
That's a good question. So we are actively looking at surge plans right now, Michael. We are, we've had to defer or cancel just a few surgeries in the last week or two, not very many, not like Ontario has been doing, but that could change. So surgeries could change because they have an impact on our ICU beds and our beds in the hospital. We may have to expand some of the areas where we put patients, and even put 2 to a room maybe, who knows? I mean, we're just thinking about all the possibilities. The other thing that people have to appreciate is that the IWK also is the repository for transfers coming in from all over the Maritimes, and when we run out of pediatric nurses in Fredericton or Sydney or elsewhere, we're getting the phone calls to take those kids, even if they're not severely ill sometimes, but if things get really crowded there. So things can get worse, and we're trying to make those sort of plans. It's a bit unprecedented right now. We've never really been in this type of a sustained situation before. And again, I would say it comes down to staffing is my biggest concern. And we aren't up to full complements in our pediatric nursing staffing everywhere. So that's my biggest worry. And Christmas is coming, and things are going to get worse. So we are going to do the best to look after everybody's kids who are seriously ill or injured. But the kids who have more moderate or minor illnesses, it's going to be tough. It's going to be tough to do that in a timely fashion. And I worry about people getting hurt because of that. So.
Dr. Lynk, can you talk to me about numbers? Nova Scotia Health issues weekly reports on how many people have COVID, what kind of COVID they have, how they got it, how many are in ICU. We don't hear any of that from the IWK. You just gave a number 200 in the room. That's the first number I've heard coming from the IWK. Can we start getting some regular detailed reports about how many children are in the IWK with what disease and what kind of condition they're in?
So I don't. So I think it's a good question. I think if you get in touch with our comms people and ask them for that information, it's not a secret. So I don't see why you couldn't.
Can you tell me how many children have died from respiratory diseases this season, and how that compares to previous
Yeah,
seasons?
to the best of my knowledge, none in the last little while have died. But it does happen. We do lose children to influenza. We do occasionally lose children to RSV and other things. Often they have underlying conditions or they're very, very young. But it does happen. It's rare.
I'm just gonna, Michael, I will take your request around, sorry, Tim. Again, I'll take your request back into the data, folks. We work together between the department and the health authorities, and I'll raise it there as well.
Dr. Lynk, the flu shot uptake is surprisingly low. Where does it need to be so that you are starting to feel a little more comfortable about the level of protection that exists within community?
Well, I'll answer personally, and I'll also let the expert Dr. Strang talk about that. But usually for herd immunity in communities, they talk about 80 to 80% plus of the population getting vaccinated. I don't know what percentages we normally get each season, Rob, in terms of, I don't think we get anywhere close to that, but this is the season to do it. This is the season to do it right now if we can try to get everybody on board with this.
Yeah, I mean, our overall flu vaccine numbers are roughly around 40% of the population, far below where it needs to be, but we still tend to have higher overall immunization numbers than other provinces. We have pretty high coverage in seniors, but since we started to introduce and emphasize flu vaccine for certainly the preschool age, that what's reported is I don't have numbers in front of my head, but top of my head, but it's very low. And this year it's below 10%.
Do you feel like enough is being, I know this isn't all on your office's shoulders, but you're the one who's here. Do you feel like enough is being done by the government, by the health authorities, by public health to raise awareness in the public of why they need to go and do this?
So there's always possibility we could do more, but I don't know what more quite frankly, we have lots of access to vaccine. We know that there's more demand starting in the last couple of weeks. We are rapidly increasing appointments, booking more appointments. We have lots of access. We continue to push out messages through media, social media. I know Dr. Lynk and colleagues have been in the media, other infectious disease folks as well. We just need the public to hear that more. And act on it. There's no shortage of vaccine, and there's no lack of access to vaccine.
Dr. Strang, I heard you use the words, you're encouraging the public to wear a mask where appropriate. Other public health officials have said strongly recommend. In your mind, are you strongly recommending the use of masks, or if your messaging is slightly different, why is that?
Well, I think my message was pretty clear. In the situations that I outlined, I said, wear a mask. No ifs, ands, or buts. Wear a mask. Though in those situations where masking is absolutely essential and going to make the biggest difference. In other places, we've never moved away from a message that we recommend Nova Scotians wear a mask in indoor public places. But what I want people to really emphasize on is where it's absolutely critical and essential that they wear a mask, and do it.
Lynk, could you explain to a parent who's currently sitting in the ER with their child who's sick, waiting a long time to get seen, exactly why is the wait what it is at this time? I know you've mentioned it. But.
Right. So the question is why are they having to wait so long in the emergency room right now? We sort of have a perfect storm of viruses all piling up on one another. So we've had a common cold virus for the last month or two. That was keeping us busy. Then RSV has just started up and taken off, and influenza now has just come as of about last week or so. So there's a pile up. That's one issue. In the last 2 or 3 years, we've had less fewer small children who've been exposed to RSV and influenza. The numbers weren't as high. So now you have a larger population who's never seen RSV or influenza for the first time and have not had their flu shots either. So you have a larger group of kids who are vulnerable. And we are seeing sicker. Normally RSV makes the under 1s, under 2s quite sick. We're seeing really sick 3 and 4-year-olds too as well. So that's part of it. And also if you're in a regional emergency room, like I was working in Cape Breton 2 weeks ago, and I just said to myself when I had to go down to see a kid in the emergency room, man, I do not want to be an adult and getting sick, because it was just wall-to-wall people in the hallways, and it was just busting at the seams. So just trying to find an open bed right now to bring your sick kid in to be seen. And that's true at the IWK. We usually triage kids from 1 to 5 when you come through the door, and even that's taking a couple hours to get triaged, to that quick assessment. So the 1s have life-threatening diseases, they come right in. The number 5s may have a sore ankle for the last 2 months, and they're the ones who are going to really wait a long time. But the number 2s and 3s, you try to bring them in, and you know they have to be seen, but you're waiting for a bed to be cleaned and opened up. And that's the type of thing we're dealing with right now. So it's the numbers of vulnerable kids who haven't seen things, and we do have staffing shortages as well, too. But we are trying to expand and have some clinics for low acuity kids to be seen and take the pressure off our EDs, both mobile and within the IWK. But again, there's only so many pediatricians or family docs or nursing staff to go around to help man those as well. So parents, I mean, if your child is sick, especially if they're babies or they have underlying problems, they have high fevers, they have trouble breathing, they can't keep fluids down, they're really tired, you're just worried about them, bring them in and we'll do our best to look after them in a timely fashion. But if they have had a sore knee for a couple of weeks or other things, I just stay out of don't use the emergency rooms for primary care right now for chronic problems. It's not the time to come, honestly.
Thank you. Oh, sorry, guys. We just need to move to the phones quickly, and we'll come back to you. Okay, Callum? On the phones, we'll start with Brian Flynn at All Nova Scotia. Brian, are you there? No. Okay, moving along. Adam Cook with Teleo Community Television.
All right, thank you very much. Dr. Strang, I just wanted to speak to you and asking you a little bit about the individual viruses and specifically about the concept that these viruses could interact with each other, COVID, influenza, RSV. Is there any danger there?
There's some people out there saying that because of a COVID infection impacts your immune system and makes you more vulnerable. I don't think that's been well established at all. But certainly if people are sick with one infection in the short period of time, they may be more vulnerable to another virus. But I think it's, as Dr. Lynk has pointed out, the bigger issue we have in the younger children is that because of the successful nature of the measures we used in the 2020 and 2021, especially protected lots of kids, not just from COVID, but from other respiratory viruses. So we have a larger total number, several age cohorts now, who are now susceptible to certainly influenza and RSV, and we have more people in our province and more children. So that total absolute number of children it has grown, and all those factors together is what's driving putting pressures on the numbers of children needing pediatric care, whether it's at the IWK or one of our other regional hospitals.
Do you have a follow-up, Adam?
Yes, I do. This one for Dr. Lynk. You were describing the wave that's coming over the next 4 to 8 weeks, or that's projected to come. Were you speaking specifically of COVID, or were you speaking more of the general witch's brew of COVID, influenza, and RSV?
Yeah, good question, Adam. No, I was referring to influenza in particular. I think that's the one that's just arrived and is piling on top of RSV and colds and COVID. Yeah.
Thank you. Moving on, we have Pat Healy with Laker News.
Hi. This question is for... Why do you think the Scotians are not adhering to the recommendation of wearing a mask in the recommended spots you mentioned earlier?
Yeah, so thanks, Pat. I mean, that's a good question. And I think a lot of people across the country are struggling with how do we actually re-engage people and to take, and it's not, and again, I have to emphasize, it's not just masking, but all those different, the multi-layered approach. There's lots of reasons potentially why, but I don't think we really truly understand after 2.5 years the challenges that we may have with people sticking with the public health measures. But that's why I'm here today, along with Dr. Lynk, to re-engage Nova Scotians and say we have a difficult 2 to 3 months ahead of us, and so we, like we've done before, we need Nova Scotians to step up and do what we're asking them to do, as we've outlined in all those multi-layered measures. It's critically important that people understand the potential, or the current and the potential stresses on our healthcare system, and each Nova Scotian can play a substantive role on decreasing those pressures and also keeping themselves and their community safe by following all the measures we're outlining. I don't know how I can stress it more strongly that we need everybody to listen and act for the next 2 to 3 months.
Do you have a follow-up, Pat?
Yes, I do. For both Dr. Strang and I think Dr. Lynk. With holiday concerts, parades, tree lightings, and cat shows coming up over the next month, what are you recommending Nova Scotians do to safely attend these events, whether they're indoor or outdoor, because of the surge of respiratory illnesses?
So I'm going to start, and maybe I'll let you jump in, Andrew. First of all, if you can do those events outdoors than indoors, great. Also be thoughtful about how many of those events you're going to go to. And if you're in, especially in indoor places with lots of other people around, absolutely you should be wearing a mask. And at all those events, the vast majority of those are what I call social events that you don't absolutely need to be at. So if you're sick in any way with even very mild cold or flu symptoms, do not go to those events. Stay home. And just being thoughtful and careful. We can still have those events, but being thoughtful and careful. And when we're having lots of family or social, friends gatherings, be extra careful, because there may well be people at those events, the very young, the very old, those with significant health issues that would need extra protection in terms of avoiding close contact to people who are unmasked if they attend those events. But Andrew, I'll ask you if you have anything to add.
Spread the joy, not the viruses, over Christmas.
Thank you. Thank you. I just remind everybody attending virtually to stay on mute unless it's your turn to ask a question. Moving on, we have Evan Taylor with Acadia Broadcasting.
Hi. My question is for Dr. Strang. I'm just wondering if it's too early, or if at this point we've started to learn a little bit about what this year's version of influenza looks like, as well as the efficacy of this year's vaccine.
So we can't really predict with great certainty, but there's two things. What happens in the southern hemisphere, we typically follow a similar pattern. As I mentioned, we've got good data from Australia that showed they had an early flu season, like we're seeing, probably a couple of months earlier than normal, but they had significant influenza activity, much of it in young people, but then it flattened right out after that 2 months. And even though they had lots of flu activity, their levels of severe illness were no greater than in a typical flu season. So that gives us some hope. We often also in Canada, we get influenza first out west and it moves west to east. So we can look to provinces west of us, and they are seeing higher levels of flu activity than we are. And I think the overall levels of activity are not abnormal, but they're early. And it's that combination of flu, RSV, and other things that is really causing pressures, especially in the pediatric hospital area.
Do you have another question?
Yeah, follow up for Dr. Strang as well. Potentially Dr. Lynk also will want to touch on this. I know Dr. Lynk had mentioned that the IWK had experienced a surge in people in the ER recently. I'm just wondering if you guys have started to notice that in the other health zones outside of HRM, Western, Eastern, that sort of thing.
Maybe, Andrew, I know you talked to your colleagues.
Yeah, so talking to colleagues from Cape Breton and Kentville last night and around the province, definitely there's, in the last week or so, a big surge. As I said, I worked in Cape Breton on the pediatric ward in the emergency 2 weeks ago, and it was relatively quiet for my 72-hour shift, relatively speaking. And my colleague who just did this past weekend, she didn't stop to eat. She just went for 72 hours and was admitting kids left, right, and center. So things have really taken off. It usually things spread from west to east. We see it in Ontario, Quebec, then New Brunswick, then Halifax, and then out to Charlottetown and Sydney and Yarmouth and everywhere else. So it's definitely hitting the regions this past week as well.
Thank you. All right, we'll circle back to Brian Flynn with All Nova Scotia. Are you there, Brian? All right, not hearing anything. We'll come back to the room and we'll start with Callum.
RSV, influenza, COVID, I guess what is most concerning and what is most surprising, if anything, about what we're seeing in this early season?
You know, what's most concerning to me is what we're seeing, the impacts on our healthcare system, on our emergency departments and hospitals. It's not so much what's out in the community and the overall levels of ultimately community spread of virus. It's what's appearing and the pressures on an already very stressed system. It doesn't take much in terms of a slight increased volume of respiratory, admissions and emergency room visits due to its respiratory virus that creates substantive challenges in our healthcare system. And I come back to the point that we need every Nova Scotian to step up now. It's not that there's something new or alarming with the viruses themselves. It's just the combination of viruses at a time when our healthcare system is exhausted after 2 years of a pandemic response, and we have human resource challenges and all those things. We need every Nova Scotian to be part of the solution.
Dr. Strang, given that seniors are at a high risk of severe flu illness, do you believe that the higher dose flu shot should be made free instead of the $82 it costs out of pocket?
So that's a policy question for government, and that is being looked at.
Dr. Strang, circling back to COVID. It's been a long 3 years. At the beginning,
yes, it has.
At the beginning of the pandemic, there was COVID expressed itself most terribly at Northwood, and 50 or so seniors died, and there was widespread public anguish and concern about that. We're now at a stage post-vaccine, post everything else, when we're having basically a Northwood every month of about 50 seniors dying from COVID, and it seems like no one cares. Can you speak to that? I mean, is it now just that we expect that 50 old people will die every month, and oh well, that's the way it goes, let's get on with life? Or should there be a different conversation happening?
So you're raising a very interesting and important question. I know I care, and my colleagues, Dr. Lynk, everybody in the healthcare system certainly care. The challenge is that the very frail elderly are very vulnerable to respiratory viruses. There's every flu season, and this is not to diminish those deaths, but we had numbers of people, probably on average, it's estimated at least 4,000 Canadians die every flu season. There was never much attention on that pre-COVID. So it's a reality, and so an objective in public health for COVID and moving forward for all these respiratory viruses, we're working as hard as we can to decrease severe illness and death. For COVID, for the pandemic, we use very strong specific measures that we would never contemplate, never ever even thought we would need, and would never have got the acceptance from Nova Scotians, Canadians to use for an annual flu season. That was very different, those tools we used for a pandemic when we had a totally new virus, lots of unknowns, and very little immunity. So now we're in a space where we have COVID, flu, RSV, other viruses, which are serious issues, especially for the very young and very old, that we need to, I would argue, we didn't take seriously enough pre-COVID. What we need to do is take them more seriously collectively. And today is a good example. It's not about necessarily, because to actually control those viruses to the point where seniors aren't at risk, we'd have to shut our society down every respiratory season. That is not possible or feasible. So we need to find a balance, and part of that balance is everybody being more respectful, if I could use that word, of respiratory viruses. And they themselves may not be at risk of severe disease, but all their actions have an impact on how much at risk their grandmother is, their very young niece might be. So we all need to step up and say, I need to do things for others in my community, and part of that is these multi-layered approach, which indicates that we have to take respiratory viruses more respectfully and seriously.
Given that, still, about half the COVID deaths happen in nursing homes. A very large number, hundreds probably, are people who caught COVID in hospital. So isn't there a public health responsibility to better manage those long-term care facilities and hospitals such that COVID isn't being spread in those institutions, as opposed to out here in the world where, whatever happens, happens?
So a couple of points. We take that very seriously. There have been significant investments in the healthcare system in terms of infection control in the last couple of years, in terms of minimizing the spread of respiratory viruses and other infectious organisms, and in particular, we work very closely with our long-term care colleagues over the last 2 years in building capacity and supports for infection control. The reality is, though, the very strict measures that we use that really prevented much impact on long-term care facilities, recognizing Northwood, those had their own substantive impacts. And one of my biggest concerns is that we have had, the first 2 years of the pandemic, we had major impacts on the health of seniors in long-term care facilities by isolating them. Many, many stories. So I don't think we can talk about seniors living in long-term care and focus only on viruses. We need to look at them collectively and say, how do we find a balance? And ultimately, there is going to be some level of risk. But we work to minimize those risks, but looking at all the risks and looking at both their physical and mental health in a comprehensive way.
Can you clarify just one thing for me? You said earlier you were talking about availability of the flu vaccine for kids. I think you said there were lots of shots and lots of appointments. Is that also the case for COVID vaccine at the moment? Is there lots of availability for kids for COVID vaccine appointments?
There is the bivalent. We know that there's been a bit more challenge for the 5 to 11-year-olds because their first 2 doses and their booster doses with what we call ancestral, the original COVID vaccine. A lot of our capacity for pharmacies has been focused on delivering bivalent vaccine, but we're actually in the process now of creating more appointments for that ancestral vaccine, if you will. I know that sometimes people are going online and booking, and they may not find a vaccine at exactly the pharmacy or the location where they want to, and they may but if they spent a bit more time and then scrolled down to other locations, which may not be very much further away, they will find an appointment there. So there may be a bit of patience and a bit of travel beyond where people would absolutely like to be doing, but there is lots of access to a vaccine, both ancestral and bivalent COVID vaccine and influenza vaccine in communities across the province. We do look at this on a daily basis and work with our colleagues in pharmacy and work with our vaccine distribution. And if there are areas where there's temporary lack of access or maybe even shortages of vaccine, we'll address those very quickly.
Can you explain a little bit more detail, give us a window into what is strained in our systems? You mentioned staffing shortages. We understand that there's ER wait times and problems at children's hospitals. But when you're talking about the need to do all these things in order to prevent the strain, what is being strained? Are ICUs also an issue? Are there empty beds? Are the beds full? If you could give us kind of as much detail as possible.
Oh, maybe I'll start. I mean, Dr. Lynk, delivering care is not my mandate, but I'm at tables where I see that. One of our biggest challenges we have a lot of challenge around people accessing primary care. So if you don't have good primary care, where do you go? And the people especially who are concerned about the health of their young child, they're going to go to the emergency department. So one of the things we're doing, and I know they're using, the NSH has been using now that you've probably seen pictures, the big mobile EHS unit. We're creating mobile primary care clinics around the province. So that's a really important one. A lot of this is the foundation of how do we address better access to primary care. So the people who are going to emergency rooms are really only the people who need to be at an emergency department. But the second one, and Dr. Lynk has talked about it, we have very tired healthcare workers, and we have many vacancies. There's a lot of capacity issues around every type of healthcare worker you could think of, again, which makes it more challenging to deliver care. So we have a system that is overall very strained, and so any significant event. Right now, it's respiratory viruses. A couple of months ago, we had a hurricane, which had more people sick, and then that in itself caused strains. So we have a system that has very little surge capacity, if you will, to deal with whatever the event is. And again, I always have to come back to people in the health system are working really hard to try to address that. But I urge and appeal to Nova Scotians that all of us need to do whatever we can to keep ourselves, our families, and our communities safe, so that our healthcare system is there for any of us when we truly need that urgent emergency room visit, that vital urgent surgery or that cancer diagnosis.
Can you maybe have an update on the children's medicine shortage, and is that exacerbating the situation at all?
I'll speak for. I know. I'm not involved in that, other than that I know it's Health Canada is working. This is a national issue and is working to kind of address that supply. I don't know, Andrew, if you have any comments.
Yeah, it sounds like we're going to be importing some Tylenol and Advil from other places soon, especially to the children's hospitals, but to retail as well. That's a huge issue. If you've got a 2-year-old home with a high fever, and you don't have anything to give them, and you know that they're feeling crummy. And it may be driving some parents to come into the EDs when they normally wouldn't, because the fever could be managed otherwise. So I'm sure that's part of the demand as well. It's a good point. And people probably know that, well, in any week of the year, we're often missing some essential drug that the supply chain has failed us. Amoxicillin is the flavor of the month right now, and that's used for ear infections. There are other alternatives. But, and maybe that's being because we've overprescribed it too. I don't know all the ins and outs of why we're so short of it, but it's a good question. Yeah.
Okay, we have time for one more question in the room.
Dr. Lynk, you've been saying that, Quebec and Ontario are a bit ahead of us with all the influenza and all the respiratory viruses, but is there anything that we can do, seeing how they're doing right now, to maybe reduce that wave here, or is it really everything we can do right now?
Yeah, so that's what the big debate is about, and it's a good question, and that's why I think together with public health and the healthcare system, we're trying to figure out a surge plan that's going to work. But like I said, it's just not up to healthcare workers, it's up to everybody right now to do the things that Dr. Strang have said, and get your vaccinations and be careful about going out in public, especially if you're sick, and the masking and the whole bit. And I think just someone else had a point, maybe from CTV, about other issues in the healthcare system. I think one thing that we've learned is that our human health resource plan is not as robust as it should be. Are we making enough nurses? Are we graduating enough lab techs? Are we graduating enough physicians in the province, in the Maritimes, in the country to not only fit the current needs, but when we have surge issues and the coming high demographics. I mean, the province is going to hopefully double in population. I think the Premier said in the next 30 or 40 years, we want more new Canadians coming in. We have an aging population. Do we have enough, and are we training enough, and are we planning enough to have enough healthcare workers to meet all those needs? And I would say there's some very smart people working on that problem right now, but we're off to a bit of a late start, and we need to really work on that. It's not going to solve today's problem, but hopefully it'll keep us out of trouble in the next couple of years if we get that right.
Thank you. That's all the time we have for questions today.